Neck pain, back pain, and sprained ankles. On this show, I want to talk about the most common reason anybody calls our office for neck pain, low back pain, and I'm going to equate that to a sprained ankle. You'll see why in a moment. This is the conversation that I have multiple times a day, all day long for years and years and years. People will come in with acute, sometimes chronic, acute neck and back pain, sometimes going down an arm or a leg, maybe not. But let me give you a couple of examples and then we'll talk about what our discussion looks like and then our treatments moving forward. Okay? So I have a young man in his late 20s. He came in because he was skating, playing hockey. He stopped and then he felt back pain. And it was local back pain, not down his leg. But he's pretty crippled at the time. He had to stop skating the whole thing. Late 20s, super fit, and now he can't move much. So he comes into my office and we get into this discussion. Another example this week, a woman comes in, she's in her early 40s, super fit, strong, athlete, the whole thing, was lifting up a big outdoor chair, immediate back pain several days earlier. Now she's crippled, not going down her leg, and there we go. So as we get into this, just keep in mind, this is not medical advice. Don't do anything that I suggest here until you talk to your doctor first. We're not forming any doctor-patient relationship, and make sure you check with your doctor before starting something, stopping something. If you have an issue that's not going away, make sure you contact your doctor's office and get yourself thoroughly examined and checked before you do anything. Got it? Okay. So the first question that everybody asks is, why do I hurt? Why do I hurt? So, as I've talked about in other shows, in the neck, you've got a bunch of segments. The bones don't hurt unless you bruise or break them. And in almost all cases, that's not what's going on. It's the soft tissues around the neck, okay? The discs, which are cartilage, the ligaments that join the bones together, the muscles and tendons and nerves and so forth. In the back, it's the same thing. You've got cartilage pads between the bones, similar to the cartilage between your knee, okay? Your knee bones, cartilage, ligaments, tendons, muscles, nerves, blood vessels and so forth that get affected, okay? So that's what's going on in the back and the neck. Now, I equate it, I tell people it's like a sprained ankle. If you roll your ankle and now you're hobbling around on the ankle, what in that ankle is hurting? It's not a muscle problem. That's number two. It's not a muscle problem. Are the muscles involved? Yes. Are the muscles the primary source of your neck and back pain? Very likely it is not. Same thing with a sprained ankle. It is not. So why do I say that? Well, if you and I go to the gym and we lift weights, we get sore the next day, right? How long does that last? A month? No, it lasts a day or two and it goes away. Post-workout soreness has a particular sensation to it. And then I'll tell that person, this pain that you're having in your neck or your back is completely different than post-workout soreness. Is that right? They're like, yeah. Okay, so we know it's not just a muscle problem. People don't call my office, chiropractic offices, physical therapy offices, and so forth with lingering neck and back pain because it's a muscle problem that hasn't gone away. No, they come in because it's pain that's not going away because it's more than just muscle. It's the discs, the joints, the ligaments, like a sprained ankle or rolled ankle, ligaments, cartilage, joints, muscles, tendons, and so forth, okay? So it's more than just a muscle problem. It's a sprain strain. So I'll tell people after I take the history and we get into the examination, I'll say, just like you sprained your ankle, you sprained your neck. These two cases I'm talking about right now, I said, you sprained your back. Your discs are irritated and your joints are irritated and now you're semi-crippled trying to get around, right? And they're like, yeah, that's exactly what's going on, okay? Now, of course, I screen people as well. Is there any weakness in your arms or legs or having any bowel or bladder changes and so forth? If there are, these are more emergency situations, I'll make a referral to an emergency room, urgent care, medical physician, whatever it might be, depending on the level of emergency in there. Most people do not fall into that category, so we can push forward and make some changes. So it's very much like a sprained ankle. Sprained neck, sprained back, sprained ankle. You'll see why we're talking about that right now. Okay, next thing. Can chiropractic help me? Is what people are wondering. Very likely yes. We don't make any promises, but very likely we tend to be very good at neck and back problems because it's the number one problem that anybody calls us for, okay? So we get into the management, we do the chiropractic stuff in the office, we give specific homework and so forth. And usually it's something we can help with. If we can't in our office, I will say so, and then I will direct them to an office or practitioner that I think might be able to help them, okay? What's the next thing on people's minds? How long is this going to take? I've got workouts to get back to. I've got skating to get back to. I'm having trouble working. I've got to take care of the kids. I can't do any housework. I'm having difficulty cooking, driving, and all this kind of stuff. And then in the beginning, sometimes sleep is even affected, okay? How long is it going to take? Well, back to a sprained ankle, right? When we sprain our ankle, how long is it going to take for that to get better? Well, we don't know typically in the beginning. We don't know because a mild or moderate or even significantly sprained ankle kind of seems about the same in the beginning, unless you're on one far end of the scale. But most of the sprained ankles fall in here somewhere where we kind of don't know in the first week or two, but then we'll start to get some evidence of it's going to be a little bit shorter or a little longer. So I'll give people a range. If it's acute back pain like these couple of cases I'm talking about right here, I'll say, let's give it 3 to 4 weeks. Sprained ankle, you go to the physical therapist, they're going to say something, hey, let's work together for 4 weeks. We'll know where we are at that point for sure, and then they're going to start seeing you 3 times a week and so forth. Now, that's also answering what people need in the beginning is, I'll have people come in frequently in the beginning, just like a sprained ankle in the physical therapist's office. They're going to start seeing you 3 times a week in the beginning, right? That's to get you the quickest results as fast as possible so you can get a good quality heal. So when it does heal, it's going to heal strong and stable. Strong and stable, strong and stable. Now, backing up a little bit, in the case of the young man in his 20s, stopping on the ice skates did not cause his injury. After peppering him with a bunch of questions, we started to realize, okay, he did some heavier stuff in the week leading up to that, okay? And the woman in her 40s who's super fit, she could lift the weight of that chair, but the chair was way out in front like this. It was a bad mechanical advantage to lift like this. The muscles in the back had to contract intensely so she wouldn't tip over, which caused pressure on the discs in the joints in the lower back, causing the injury. If that chair was the shape of a briefcase, she probably would have not injured herself. So we already got into, if you need to lift a chair like that, never do it again. Never do it by yourself. If you have a window air conditioner, never do it by yourself. If you're lifting up a case of water bottles at the grocery store, buy a water filter for home. Stop buying bottles of water at the grocery store. Or until you get that water filter, have somebody else lift it with you and don't put it in the back of on the cart. So we get into the whole education thing of ergonomics, which usually led us to these things as well, okay? So how long it will take also determines on homework. And that's the last part of this. What should I do and what should I not do at home? So that's the last part of this. What should I do and not do at home? Okay, so with a sprained ankle, the ankle is going to give you instant feedback of what you can do and what you can't do. Let's say you're a runner, you sprain your ankle and now you can't run. So you realize, okay, I can start walking right now. I can walk a 1/4 mile, but if I walk more than that, the ankle swells a little bit, I get a little bit of pain. Then clearly the ankle says a 1/4 mile is maximum right now. Let's say a couple weeks later you can walk a 1/2 mile, but if you go beyond that, the ankle swells a little bit and so on and so forth. The ankle is going to give you very specific feedback. You can do this and you can't do that. Then you can walk at full steam, but you kind of have to be careful on stairs. So the stairs kind of bother you on the ankle. Now, if you're having trouble walking or you're having trouble on stairs, do you think you're ready to run yet if you're a runner? Kind of no, right? No? So again, the body's going to tell you, you're not ready to run yet because you're not doing these other normal things here, okay? So you're going to listen to that sprained ankle. And I talk about this with people with neck and back problems because I tell them, your neck and your back are going to tell you you can do this, but you can't do that, just like a sprained ankle. And even if somebody hasn't sprained an ankle in the past, they can relate to this because they can just kind of understand, yeah, they've either known people that are hobbling around or whatever, that it's going to take time for this to get better before they can get back to X activities that they want to get to, okay? So you have to listen to your body. Then I'll ask people, if I injure my ankle and it's swollen up like a balloon, what do I use for that at home? Do I use ice or heat? And everybody says ice. Great. Then I'll say, 3 weeks later, the swelling is down 50 to 75%, but it still swells a little bit at the end of the day. Should I switch to heat at that point? And they'll say, no, you would still ice. I'm like, yeah, there you go, right? So then I said, what should you do for your neck and your back? You have a sprained neck, sprained back, like a sprained ankle. You just can't see the swelling, but what you should do, they're like, oh, okay, I got it now. It's ice and it's always ice. 3 weeks from now, 6 weeks from now, the pain is down 50 to 75%, but it still hurts at the end of the day and so forth. Should you switch to heat? Nope, keep it at ice. It's always ice, and then I'll always ask people, do you ever see athletes using heat? And for the most part, I usually have to whisper, I'll say no, say no. They're like, no? And they're like, okay, yes, so that's right, it's always ice, so it's always ice. The other thing that I tell people too is if I'm giving you stretches, if they're allowed, depending on where you are in your circumstance with your neck and your back, stretch first, ice last. Stretch first, ice last. Now you might go to physical therapy and as time goes along with the sprained ankle, they might actually heat up the ankle, do all of your workouts and stretching and activities and stabilization exercises and so forth, but they're going to finish you with ice at the end. Make sense? It's always ice, it's never heat. Got it? Okay, so even if it feels good to put on heat, it's the wrong thing to do. It's going to make you swell up later and make you hurt worse later. So listen to your neck and your back, and with these two examples of this young man in his 20s and this young woman in her 40s, I just had to let them know, just like a sprained ankle, let your neck and your back dictate what you can and you can't do. I can only sit for a half hour, I got to get up and move from my back. Well, then there you go. I am working from home every couple of hours. The pain kicks up a little bit because I'm working. There's some time for some ice. It hurts just to do normal things around the house. Can I work out yet? Kind of no. You know the answer is no. So even though we want to get back to these things, I want to see them back to these things as soon as possible. They want to be back to these things as soon as possible. If we go back and run too soon on that sprained ankle, it's going to slow down the recovery process, and you're going to actually miss even more time from the workouts that you desire and so forth. I explain it to people just like that, and they're like, yeah, I got it. So we have to reel them in until that process gets better. Now, usually we can dig in a little bit more, just like I talked about with these folks, and we can start getting into ergonomics. Do you follow? We get into ergonomics so they start taking better care of their spine. We know how to brush our teeth and floss our teeth early on because we were taught as kids, but we were never taught how to care for our spines so these things don't happen over again and over again as time goes along. You see? So that's why I talk a lot about sprained ankles in my office, because people can wrap their head around this as we're talking about acute and chronic neck and back pain. I'm Dr. Scott Fuller. Thank you.